Caraga Kontra COVID-19, bringing you the updates of the Corona Infectious Disease 2019. Maayong adlaw Caraga Region ug sa mga gasubay online. Kini nga programa giuluhan sa Department of Health, Caraga.
Mayong adlaw Caraga Region. Ani ang usab kita sa programang Caraga Kontra COVID-19. Ug karong adlaw, akong giahog ang atong Assistant Regional Director, Dr. Rodolfo Antonio M. Albornoz para sa paghatag sa Caraga Situational Report o sa breaking news.
Maayong adlaw, Caraga. As of June 11 at the national level, we have 24,175 confirmed COVID-19 cases. 5,165 have recovered and 1,036 deaths. At the regional level, we have a cumulative number of 148 suspect cases. They are from Agusan del Norte, 28, Agusan del Sur, 7, Surigao del Sur, 5, Surigao del Norte, 2, and none for the province of Dinagat Island. 75 from Butuan City, 13 Cabadbaran City, 9 Surigao City, 4 Tandag City, 3 Bayugan City, and 2 Bislig City. 13 of those suspect cases are currently admitted at the following hospitals: 2 at the Caraga Regional Hospital, 4 Butuan Doctors Hospital, 1 at the BMC Annex, 3 at the Manuel J. Santos Hospital, 2 Agusan del Norte Provincial Hospital, and 1 Nasipit District Hospital. For the probable cases, we have a cumulative number of 31. 22 are from Agusan del Sur, 3 Surigao del Sur, 4 Bayugan, and 2 Tandag City. 4 of these number of probable cases are currently admitted at the Agusan del Sur quarantine facilities. Last night, we received 62 RT-PCR results from the Southern Philippines Medical Center, Davao City. And out of these 62, 51 revealed negative. 7 are from the suspect cases. They are from Nasipit District Hospital, Agusan del Norte Provincial Hospital, Caraga Regional Hospital, Butuan Doctors Hospital, and MJ Santos Hospital. 5 are from the probable cases. They are from Adela Cerati Memorial Medical Center and Agusan del Sur. 36 of those negative results came from the high-risk individuals and health workers with relevant history of exposure and travel. From the 51 negative findings, 3 were from the follow-up confirmed cases. They are as follows: the 6th case is a third follow-up test, the 8th case a second follow-up test, and the 9th case a first follow-up test. These negative follow-up RT-PCR results will help in the further management and evaluation of these cases. From the 62 results received last night, 11 are positive. And from the 11, 3 were follow-up tests from the existing confirmed cases. They are as follows. The 7th case is a second follow-up test. The 10th case was a first follow-up test. And the 11th case, a first follow-up test. From the 11 positive results, we now have 8 new confirmed cases. The first individual is case number 15. He is a 53-year-old male, a returning overseas Filipino from Agusan del Norte, arrived in the Philippines last March 15, traveled to Cagayan de Oro on June 4 via Philippine Airlines flight PR 4525 and arrived in Caraga on the same day from Cagayan de Oro via bus. He is asymptomatic and on strict quarantine facility. The second individual is case number 16, a 25-year-old male, returning overseas Filipino from Agusan del Norte, who arrived in the Philippines last March 18, traveled to Cagayan de Oro on June 6 via Philippine Airlines flight PR 4527 and arrived in Caraga on the same day from Cagayan de Oro via bus. He is asymptomatic and on strict home quarantine. The third individual is case number 17. He is a 26-year-old male, a locally stranded individual from Butuan City, who arrived in Caraga last June 6 from Cebu to Nasipit via to-go vessel. He has mild symptoms and on strict quarantine facility. The fourth individual is case number 18, a 23-year-old female, locally stranded individual from Butuan City, arrived in Caraga last June 7 from Cebu to Nasipit via Cocaliong vessel. She has mild symptoms and on strict quarantine facility. The fifth individual, case number 19, is a 47-year-old male, locally stranded individual from Butuan City, who arrived in Caraga from Cebu to Nasipit via Cocaliong vessel last June 7. He is asymptomatic and on strict quarantine facility. The sixth individual is case number 20, a 22-year-old male, a locally stranded individual from Butuan City, arrived in Caraga from Cebu to Nasipit via to-go vessel last June 6. He has mild symptoms and on strict quarantine facility. The seventh individual is case number 21. He is a 56-year-old male, a returning overseas Filipino from Butuan City, arrived in the Philippines last May 30, traveled to Cagayan de Oro on last June 8 via Air Asia flight number Z28616 and arrived in Caraga on the same day via bus. He is asymptomatic and on strict quarantine facility. Then the last individual is case number 22. He is a 35-year-old male, a returning overseas Filipino from Surigao City, arrived in the Philippines last March 26, traveled to Cebu from Manila via to-go vessel on April 28 and arrived in Caraga from Cebu to Surigao City last June 7 via Cocaliong vessel. He is asymptomatic and on strict quarantine facility. As of June 12, Caraga region now has a total of 22 confirmed COVID-19 cases. They are distributed in the following areas: 9 at Butuan City, 7 Agusan del Norte, 2 Agusan del Sur, 2 Surigao City, 1 at Cabadbaran City, and 1 at Bayugan City. We must work together to conquer this continuing battle on COVID-19. To protect yourself from the virus or any other disease, we advise everyone to consistently follow our health tips like regular hand washing, proper wearing of face masks, and physical distancing of at least 1 meter. We also emphasize that our body's defense from diseases is a combination of factors on proper diet, adequate rest, sleep, and exercise. So get enough hours of sleep, avoid sedentary lifestyle, and consume nutritious food. Our dear Caraganons, if going outside is unnecessary, better stay at home.
Daghang salamat, Dr. Albornoz. Sa atong pagpahibalo sa publiko sa sitwasyon sa COVID-19, ato usab gipahinumduman ang tanan ang pagsaulog sa atong Independence Day isip usa ka gawasnong nasod. Kini usab nagpahinumdum kanato nga atong padayunon ang atong strong solidarity and unity as we work together to fight COVID-19. And the best way to do is to protect yourself, your family, and your community. Sa kanunay, among giyawag ang tanan nga maminaw lamang kita sa opisyal nga balita. Kung aduna mo'y pangutana or dugang impormasyon, text or tawag sa COVID hotline numbers.
For DOH Caraga hotline numbers 817-6546, 0945-359-2632, 0948-224-1857. For psychosocial counseling sa Caraga State University, aduna sila mga pipila ka numero nga pwede tawagan depende sa oras. For National Center for Mental Health Crisis Hotline, kindly dial the following numbers. Aguzan del Norte, Aguzan del Sur, Surigao del Norte, Surigao del Sur, Province of the Nagat Islands. Per DOH official Facebook page, kindly like DOH Center for Health Development, Caraga. Hangtod karon aduna paghihapon ang atong DOH Caraga 24 Hours Operation Center. Amo ipaklaro sa mga katawhan ang atong protocol sa referral. Ibahin kini sa duha: hospital referral o community referral. Para sa community referral, mao kini ang flow. Adunay motawag gikan sa komunidad. Ang motubag niini mangayo og mga detalyadong impormasyon para masayran ang katuyuan ug mahatagan sa saktong impormasyon or serbisyo nga gikinahanglan. Then DOH will validate the case. Then DOH will contact the respective LGU concern, pwede sa Municipal Health Office, City Health Office, or Provincial Health Office. O kung gikinahanglan ang kaso dalhon sa hospital, i-facilitate sa LGU ang pag-transport sa pasyente ngadto sa referral hospital. O sa ikaduhang referral flow, kung ang tawag gikan sa usa ka hospital. Ang hospital manawag sa DOH Operation Center. Ang motubag niini mangayo og mga detalyadong impormasyon para masayran ang katuyuan ug mahatagan sa saktong impormasyon or serbisyo nga gikinahanglan. Then, the DOH will validate the case. Kung gikinahanglan nga ma-transfer ang pasyente, tawagan sa Operation Center ang referral hospital for COVID cases aron makasayod ug makapangandam ang maong hospital. Tawagan usab sa DOH Operation Center ang LGU concern aron ma-facilitate ang pag-transport sa pasyente ngadto sa referral hospital.
Ug mao kato ang balita karong adlaw. Daghang salamat. Stay safe, Caraga.